all places of worship are to remain closed.
Some churches still flout the order, but the task force set to ensure compliance are on ground to stop defaulters. However, many churches, in compliance with the order, have gone online. Places of worship have been closed. Streets known for heavy traffic following church services are almost empty across the city center. We noticed some commercial vehicle drivers are not implementing social distancing rules. At the Utako Motor Park, there are no vehicles loading inside, and full fumigation of the premises is in progress. The Abuja Municipal Area Council is spearheading the fumigation exercise, and they say they have their work cut out for them.
We have the intention of even fumigate all our markets in order to curtail all these communicable diseases. Unfortunately, the issue of COVID-19 came off, and we now use that time to fumigate all our markets. In fact, today we are fumigating 13 of our markets within Amak.
The places fumigated are to remain locked for 24 hours, pending further instructions. Residents of the nation's capital may be waking up to the reality of COVID-19, and these empty streets must remain empty to flatten the curve of this virus. Kayla Magwa, Channels Television News.
Meanwhile, the police in Katsina State say they have arrested about 99 suspects for allegedly burning down a police station and attacking officers on duty in Kusada local government area of the state on Friday. This follows a riot by some youth who staged a protest against government's directive banning all religious activities, including Friday prayers, as a preventive measure against a possible COVID-19 outbreak in the state. The police arrested the cleric who flouted the directive by conducting a Jumat service at a prayer ground within the local government.
On March 26, 2020, the Katsina State government issued an order suspending large gatherings for Friday prayers and Sunday church services. The measure was taken to curtail the spread of coronavirus. But that order has not gone down well with some youths in the state who rioted after the police arrested a religious leader who conducted Friday prayers at one of the Kusada Jumat mosques.
Very unfortunate incident indeed. Unfortunate because this attack, as you can see, is unprovoked. Set the police station ablaze. Some other residential quarters belonging to the police were also razed. So many vehicles, about 9 or thereabout, were also set ablaze.
A federal lawmaker from the state in House of Representatives condemns the action of the youths.
Simply, I can say my recommendation is to let the constituted authority did or do whatever is possible to push out the culprit and punish them or let them face the full wrath of the law.
Although normalcy is gradually returning for the community, women and children are left to cater for themselves, as their caregivers, especially their husbands, have deserted their various communities for fear of arrest.
Soldiers were deployed to our community. 2 of our community members killed, and some found their way to forests. As I'm talking to you, our husbands are inside the forest, leaving us fetching water and taking care of ourselves.
Those affected are calling for government assistance. During a visit to areas affected, Channels Television learned that business activities are at a standstill because of the curfew in place. Meanwhile, the State Commissioner of Police, Sanusi Buba, had since deployed police patrol teams and a special joint security task force to enforce the ban on public gatherings in the state.
Health workers armed with temperature monitoring devices and sanitizers have been screening road travelers on all entry points into Borno State in the northeast. A state committee on COVID-19 headed by the Deputy Governor Umar Kadafur supervised the session as the body temperature of the travelers is checked. He explained that those with travel history of interest that had flown into Maiduguri were tested and the results had come back negative, all of them. The Deputy Governor says the new measure will help ensure that no one imports the disease from other parts of the country into the state. Israeli nationals resident in the Federal Capital Territory, Abuja, and in Lagos, Nigeria's commercial capital, are being airlifted out of the country as a precaution against contracting the coronavirus disease. The Israeli Deputy Chief of Mission, Mr. Yotam Kreiman, who supervised the evacuation at the Nnamdi Azikiwe International Airport, explains that the exercise became necessary owing to the global increase in the number of cases of COVID-19. A private Nigerian airline is evacuating 274 Israelis made up of embassy staff and other nationals working for private companies in Abuja on a direct flight to Israel. The Lagos contingent was earlier airlifted from the Murtala Mohammed International Airport to link up with their counterparts in Abuja.
In 60 years of the diplomatic relations and friendship between the State of Israel and the Federal Republic of Nigeria. What you have seen today, it was an historic moment. It was an historic flight. For the first time ever, a Nigerian airline was flying with more than 200 Israelis, women, children, and elderly people because of the regulation and the crisis that is right now all over the globe, and of course also in Nigeria, the coronavirus crisis. This is something that I was dreaming about, not on this occasion, but unfortunately we had this beautiful flight, direct flight, done by the Nigerian airline for the first time, flying for 5.5 hours over Sudan, over Egypt, and of course before that, over Chad.
Sunday service today failed to hold in Yenagoa, the Bayelsa state capital, as many churches complied with the state government's order banning all public gatherings, including religious activities. Our correspondent Dobra Timiwood, who went around to monitor the situation, notes that many worshippers were left disappointed.
I am along the east-west road, and I'm at a very strategic location because this is the Imbiama section of the east-west road. My right leads to Delta State. You pass through Bayelsa but get to Delta State. My left leads to River State, and in front of me is the gateway into Bayelsa State. Now these trucks behind me have been here for the past 3 days. It has been a lockdown on this region, as every state that has their border at this point have said no entry, no exit. Since on Thursday, drivers of these trucks have had to rely on getting food from local food vendors around here for their daily survival. Only those that are with edibles are allowed to pass.
From day 4 years and 3 days ago, I was here. There's no road. They send a cow, food item, now they carry part plus both the onions. They even allow those on pass. I explained for them, saying I'm biscuit. I carry. They don't even allow me to pass. And my to see their back. 3 days here, they suffer.
Now, the essence of this lockdown is to curb the spread of the coronavirus. But look at everybody. How many people here are with their face masks? How many people are wearing gloves? Now, how many people are even maintaining social distances? Dobra Timiwood, Channels Television News.
The federal and state governments are using all necessary measures to minimize spread of the coronavirus in Nigeria. This evening, President Muhammadu Buhari revealed that the government is planning for all scenarios. So what are the insights from the president's message, and what's the forecast for the next 14 days? Channel Television's data consultant Babajide Ogusanwo is here to analyze the president's speech and the latest domestic trends. Thanks for being here, despite the fear on the streets as well as the limitations to transportation. But the president gave new directives this evening, a lockdown of interstate and intercity travel in Lagos, Ogun State, and in Abuja, the FCT, from 11 p.m. tomorrow. How will you summarize the president's speech?
March the 2nd, I'd like you to keep that date in mind because I'll explain its relevance very soon. Speaking about the president's speech, the summary is there are 3 insights. The first is the president talked about a 2-step approach that we'll be using. That's the first insight. We'll be focusing on preserving lives and protecting businesses. That is the first insight. The second insight is that we will be collaborating. What do I mean by collaborating, or what does the president mean by collaborating? In this speech, he had used the word I, referring to himself, only 18 times. He had used the word we 37 times. And so that is the focus, the second insight, collaboration. Now, the final and the third insight is, since it will be collaboration, how would we be collaborating? Now, the president had talked about 3 ways we'll be doing that. He has said that first, we are fighting a war, in the president's words. COVID-19 is a war. The president, in this speech, said, we are the greatest weapon to fighting this war. That's exactly how the president put it. And finally, the president said, we will be using 3 things: border measures, health measures, physical and monetary policy. That's the summary of the speech. You know, Amarachi, exactly today is 4 years and 10 months that the president has spent in office. The president is not an orator, and this isn't a perfect speech. But looking at all the speeches he has given in the last 4 years and 10 months, for me, this has been his most impressive.
Indeed. Now, Nigeria we've just announced 111 cases confirmed. What's your forecast for new cases?
You know, exactly last week, I sat on this seat and there were only 30 cases. Today, 111 cases. What does this mean? It means that we're running faster than even Usain Bolt when it comes to new cases that are coming up. If we continue with this rate, almost 4 times, in the next 3 weeks, we could have thousands of cases. Tonight, I have 3 news. I've got some good news, I've got some bad news, and I've got some very bad news. But I'd like to start with the good news. What is the good news? We've seen 111 cases, only 1 fatality. Here's what it means. There's a 99% chance of survival if you have the disease in Nigeria. That is good news. Now let's talk about the bad news. The bad news is that Nigeria is among the 7 most populated countries in the world. So I'd like us to take a look at the number of cases that have been reported in the most populated countries in the world, Amarachi. And if we take a look at that, here's what you find. China, the most populated country in the world with a population of 1.4 billion people, 83,000 cases. India, 1,000 cases. In the US, 130,000 plus cases. Pakistan, Brazil, we've seen 4,000 plus cases in Brazil. But in Nigeria, only 111 cases. Now, if we look at these countries, the countries that are the most populated countries, we see that there are clearly more number of cases than Nigeria. So the bad news is there's a huge possibility that there are more unidentified cases. And finally, the very bad news. On the 2nd of March, just like Nigeria, the United States reported only 111 cases. Just some weeks ago, today, they have 130,000 plus cases. So we need to focus on making sure that we listen to these new measures that the president has read and we obey it. And yes, there's some hope. You know, this week I spoke to the president of the Nigerian Medical Association, Dr. Francis, and I asked him just one question. Dr. Francis, does Nigeria have enough medical professionals to manage this pandemic? His answer?
What was his answer?
Let's look at the number of doctors we have in Nigeria. Okay. That will provide us some of the answers.
And before you go into that, you did say earlier that this was the president's most impressive speech. I was going to take you up on that, why you think that is.
Because it was clear, and his outlines of the measures were very directive. Were very direct. It was clear on what will happen in the next 48 hours, and it was clear on what the president intends to do and the government intends to do within the next 14 days. We've seen a lot of speeches from the president, but none has been this clear. But finally, I'd like us to take a look at the number of medical professionals in Nigeria, because that gives an idea of what could happen. In the Southwest, today we have 42,000 medical professionals. In the Southwest, we have 3,200 medical professionals per citizen. But the challenge is the Northeast, where we have the least number of doctors per citizen. In the Northeast, we have only 1 doctor per 17,000 citizens. So it is essential that the virus, yes, is minimized across all regions, but there are some regions that it's important that we don't allow the virus to spread. And you know, in the final analysis, whenever a virus spreads this fast, the only solution is for good decision to move even much faster.
Babajide, I love the way you do the numbers. You've put out some really grave numbers out there. Thank you again for being here on the News at 10. Hopefully you'll be with us again next week. Still ahead on the News at 10, the UK's health authorities say it may take 6 months before life returns to normal in the UK following the outbreak of the coronavirus. Plus, International Olympic Committee and Japanese organizers are in the final stages of talks to set the opening date for the Tokyo Games in July next year. More in sports news. Stay with us.